Now at noon, a federal judge has blocked some of the efforts by Health and Human Services Secretary Robert F. Kennedy to reshape U.S. vaccine policy.
And doctors across Metro Atlanta celebrating a ruling that blocks changes to the number of vaccines that children can receive. Atlanta News First, Alani Latang speaks with a pediatrician about this decision.
On Monday, a federal judge blocked the Health and Human Services Secretary RFK Jr.'s childhood vaccine schedule, ruling a January vaccine schedule overhaul did not go through proper legal channels.
I'm happy.
Kennedy's plan would end broad recommendations for all children to be vaccinated against RSV, hepatitis A and B. Pediatrician Dr. Helena Bentley says where this ruling could create clarity, it also might leave it harder for people to interpret, amid her seeing fewer parents vaccinating their children.
So when you wishy-washy like this, and I'm saying wishy-washy, you got this government official saying this, but then you got the federal judges, which are government employees as well, blocking. That can be confusing to a certain population of people.
The ruling stems from a lawsuit by the American Academy of Pediatrics and other medical groups. They argue RFK's vaccine recommendation changes, plus the remaking of the CDC Vaccine Advisory Committee, violated federal law. In a statement, the U.S. Department of Health and Human Services says HHS looks forward to this judge's decision being overturned, just like his other attempts to keep the Trump administration from governing.
That's what they say about everything that they've done. And they continue to waste resources, and they continue to waste time, in my personal opinion.
Dr. Bentley says the CDC's constant changes meant spending extra time counseling patients.
So the burden is on us to try to convince them, or try to, and I won't even say convince, to really inform people from a medical point of view.
The ruling also pauses any votes Kennedy's advisory committee has taken since June, including the newborn hepatitis B vaccine.
Vaccines are safe. The risk of severe side effects of vaccines is minuscule compared to the risk of complications from whatever disease we're trying to.
Alani Latang, Atlanta News First.